We are Pro Cannabis Media.
All right, here we go. Welcome back to Cannabis Chat for a Monday afternoon. I'm Jimmy Young in the Pro Cannabis Media studio. As we always are on Mondays, joined by the CEO of flowerandtonic.com. Her name is Alissa Merrill. She's my go-to person whenever I need to talk to somebody intelligent. Okay? Because Lord knows we are talking to so many doctors and scientists. So I admit my liberal arts education, history major at Tufts University only takes me so far. So now we want to welcome in Ruth Fisher, a PhD, of course, because, you know, after all, we only talk to doctors or PhDs on this show. And Ruth Fisher, thank you so much for joining us this afternoon.
Oh, it's my pleasure. Thank you for having me.
So you've got a book out called the Medical Cannabis Primer. It's available on Amazon. First of all, what is in that book, and what kind of prompted you to decide to write a book about this?
Well, you know, I have to admit I'm a traditionalist, and I was very much caught up in the whole stigma of this is your brain on drugs. And I smoked pot before and decided it wasn't really my thing and was a little judgmental about it and other people using it. I've done a lot of work in healthcare, and I've spent a lot of time doing research in the healthcare industry. And early on, I had heard about cannabis being used for medical purposes, especially during, say, the AIDS crisis, when it started gaining more momentum. And I really, to be honest, I just kind of dismissed it and didn't even really think about it. So fast forward now 25 years, my brother, about 5 years ago now, was diagnosed with multiple sclerosis. And he gets tremendous amounts of neuropathic pain. And he's been on every drug there is, and they're just, the side effects are horrible. And he was getting a little bit of relief, but not nearly enough. And at one point, one of his neurologists said, you know, I think maybe you could benefit from medical cannabis, but I can't give you any guidance. Right. And so
I want to give that doctor credit for even mentioning that in any kind of a patient doctor. That kind of puts them out there a little bit. Was this in California by any chance?
Yes, it was.
Yeah.
Yes,
there are obviously more enlightened doctors, I believe, in California. I just think they are. I mean, probably all my friends at MJH and Beth Israel in Boston want to kill me right now.
It's a different environment. It's completely different environment there as well.
Do you think we'll get to the point where people will look at it not as a last resort, but as a immediate option when diagnosed with something like MS?
I have a good friend who's trying to advocate exactly for that. She uses cannabis for TBI. And she said, you know, it shouldn't be a last resort. And there's so many people in cannabis who are advocating for it, who have gone through the traditional healthcare system and have been completely let down and disappointed by the system, and somehow found cannabis on their own. And it's literally saved their lives. There are so many people whose lives have been given back to them by cannabis, and they're all saying, why is this the last resort? Why is this something I had to find on my own? It really needs to be a first line of defense.
But coming at it from your background as an economist, correct?
Economist, yes.
Economist. Oh, just kidding. I was trying to be all fancy and pronunciate like you guys. So you're coming at it from such a different perspective, and again, like doing the research. You know, could you speak a little bit more to that, and then kind of how then you came to your recommendations based, you know, in the book? Because I think we're going to be at a place now where people are going to all have different opinions. So how do we know like where to go? I think I'm suggesting that you are a great person to go to, but I mean, for other people, it's challenging to find.
It really is. And to be honest, so my brother at some point, he started using cannabis and he was getting some good results, but he realized he probably wasn't getting nearly the benefits that he could if he knew how to use it better. So at some point he called me in for help because I've spent a lot of time doing medical research. And so at that point I said, you know what, I don't care about what I might believe about this or, not believe. He says it's working. That's all I care. Let's see if we can, help him better. So at that point, I dove in and started reading, and I'll tell you, I'm not a medical doctor, but I've been heavily involved in medical research. I've worked on AIDS, I've worked on diabetes and a lot of different indications. And I nearly fell off my chair when I learned about the endocannabinoid system. And I found it so hard to believe that there was this major, it's not some minor thing. It's this major system that essentially controls everything else in our bodies. And so few people are aware of it. And I was totally floored. And at that point, it wasn't even at that point, it was a little bit before when it was gaining credibility. But with my understanding of the endocannabinoid system, that was a total game changer. And it completely legitimized for me the use of cannabis for, we're just at the beginning. They're going to find that it's going to be beneficial for so many different conditions out there. But I will admit it took me a long time. Now, I'm an experienced researcher, and what I do is I see things from a systems perspective. Mm-hmm. And when I enter a new industry, and for me, this was a new industry or a new market, what I do is try and understand what the big pieces are and how they fit together and what are the interrelationships of everything. And I've done this for every type of industry there is. And so I'm reading about cannabis, and I couldn't figure it out. There's so much information out there, and it's coming at you so piecemeal. And trying to figure out kind of how it all fits together and what's the big picture. And so one of the things that was causing me problems, for example, is on one hand, I'm going through the medical journals on cannabis, and there are literally tens of thousands of medical journals on cannabis. And while there are many saying that it's harmful, there are plenty saying that it's effective. And there are preclinical studies and clinical studies saying it's effective. Yet, whenever you talk to a doctor who isn't aware of cannabis or hasn't, come to a realization that it's a good thing, they say, well, there's no medical evidence. And so, I keep saying, well, there's no evidence that it's safe and effective. And on the other hand, there's literally thousands of journal articles. And I sat with this for a long time before it was kind of cleared up that, oh, okay. So this is kind of when the pieces started falling into place. You have these different perspectives out there, and they're all looking for kind of different pieces of the picture in order to themselves about the benefits of cannabis. The traditional healthcare system, when they say there's no medical benefits, what they're saying is it's not FDA approved, and or there's no random control trials. Mm-hmm. The reason there's no random control trials is because it's very expensive to run them. And mostly those are done by companies seeking to get FDA approval. And so, when they say no medical evidence, they're talking about a very specific thing that it's kind of a chicken and egg. Well, people in cannabis, if they're trying to research cannabis, generally, if you're doing the whole plant, which is the way that I believe to approach it, the whole plant approach, it's very difficult to patent. And if you can't patent it, then you can't generate the money to pay for the clinical trials.
Right. So it's like saying tomatoes are good for you. Okay, so who's going to prove it? Papagenos, Domino? Like if you want to try to say that tomato sauce and tomatoes is good for you, like no one is going to, right? Is that the dumbest? Yeah. We need to dumb things down a little bit sometimes for even ourselves. Yeah. And that's how I look at it.
So there's no random control trials, but there's literally billions of case studies.
Right.
So yes, it's anecdotal, but there's billions of anecdotes. But so anyway, so I was going through all this and I just kept reading and reading and reading. And then finally some of the stuff started to dawn on me and I was able to put it together. At some point, my brother, who's an engineer, he came up with an idea for a technology to help people find cannabis better. So my job for that would be doing research to try and kind of figure out some of these connections. So at that point, I really started the research. And after putting quite a bit of time into it, I put together my puzzle. And so I was able to at least understand how the pieces worked. And especially because I had so much trouble, I think, and was able to finally do this. My brother at some point said, you know, we have this information and you put it together in such an amazing way. I think we really need to make it available to other people. So let's compile it into a book. And aside from being an engineer, he's also a photographer, and he does publishing and layout and design. So he took my text, which was I thought kind of boring maybe. I tried to make it good. And he put it into amazing formats, a lot of really beautiful charts and diagrams and photos. So that's kind of the story of the book.
Yeah, I don't print out a lot, but I loved, she had a chart, just a little, can you see that? It was just, it's cute. It looks cute. But more importantly, it very well defines, because we were in the earlier conversation, we were just saying, and I know that this must frustrate you when you say cannabis is good for ADHD. You really need to narrow it down to disease state or condition to really have the best effect. So that's really what you're able to do, like looking at endocrine disorders, spasms, PTSD, and what type of combinations work best together. I mean, this is awesome information. It's available on a poster and it's in your book, correct?
Yes, it is. Yes, it is.
Great.
How are we ever going to share and educate the public? I mean, Lord knows if we could print 150 million of those books and distribute them to all the voters, it would be a great thing. I'm sure you'd be very happy about that as well. But one of my biggest frustrations as a media or a former media person is the lack of public service information that traditional media will share with the public. Now, we're sitting here in a pro-cannabis environment. We're talking about all the benefits and the research behind some of the science that has led this green wave. But there's still, I don't want to call it censorship, but it's censorship at the social media level, and the traditional media level won't even allow you to run a PSA like Acreage Holdings tried to do, telling 3 amazing stories about how cannabis saved people's lives. I get so frustrated by it. As someone, you're in California, you're in the Bay Area. Are there public service announcements about any of the benefits of this plant anywhere in media?
No. I think it's going to need to we're going to need to wait until it's rescheduled.
Yep. Okay. Hopefully that won't happen. That won't be so long, right?
Hopefully, yes. Yes.
I mean, I don't think it's going to happen during the lame duck, let's just say, but perhaps in the first 6 months of 2021. Wouldn't it be nice if this vaccine works and everything moves along swimmingly at the federal level? We're able to get it out to people, and then people are then becoming more and more enlightened about the benefits of cannabis during the same time. And perhaps an administrative phone call might happen to the Department of Justice from the president-elect who says, get that cannabis stuff off Schedule 1. I don't think it'll be that blatant, but I do think that we're going to move in that direction of some kind. It's going to be fascinating to watch what happens at the federal level, because I'm big on not only should they deschedule it, but they've got to keep researching it. They've got to keep people like yourself working on finding out exactly what each cannabinoid does to the endocannabinoid system in all of us, because there seems that there's so many benefits to so many people.
I absolutely agree. And especially after this year, 2020, I think we all deserve a break.
Well, it did get ruled essential, at least the medicinal side of things for cannabis. And that was a huge step of acceptance during this pandemic. And of course, we've all seen what happens to the human element when you have time on your hands and nothing to do. The liquor sales and beer sales went up, as did the cannabis sales, because we're human, right?
Now, I do know, I think this is kind of interesting, that there's a lot of people out there trying to obviously have certification systems done. But the big push is to get cannabis reimbursed by healthcare providers. And once that happens, you're going to see a flood of activity. Now, if you look at, there's plenty of studies out there that show that when cannabis is legalized, you get a massive drop in pharmaceutical use. people stop using or either use less of their other pharmaceuticals or switch altogether. And there's plenty of evidence to show that, for example, cannabis and opioids are complementary. So you can radically reduce your use of opioids. So maybe it has some benefit by using a much lower dose. You're going to obviously you're going to reduce the potential for bad side effects. But when you have these drops in other medication use, and so obviously from the provider, from the health, insurance companies, and from the patients and doctors' perspective, the cost of treating medical conditions will definitely go down. The problem is this is counter to the pharmaceutical industry's interests. And
Right.
so you get a lot of backlash from them. And so it's going to be a power struggle there, I think. But as I said, I know a lot of people working on trying to get the healthcare reimbursement done. If and when that happens, I think there's going to be a radical flood of activity.
I believe now there's some reimbursement already happening for the workman's comp patients, little pockets in certain states. I don't know exactly the circumstances, but yes, I think we're closer than people think. But at the same time, what products though? Like, are they going to do you think it'll be products that have an indication through a pharmaceutical company, or like, this is where I get excited about it, but then I'm like thinking out the logistics, and I'm like, is it gonna? Because I actually in Massachusetts, there's a psychiatric hospital near me that has like a CBD formulary product, and that's exciting to me because you and I talked about this briefly. Like, the worst thing is when you take someone, from a perspective where they don't believe in this, and then like, oh my gosh, there's something here, and then you go try a product. So many are bad, and there are so many that are pushed. The top ones on the market are not the ones I would recommend. So it's like it's certainly a challenge. I hadn't even thought out to the patients like who are going to require such a higher dose that they won't be able to afford it. So yeah, I guess I'm trying to figure out where it'll go. And my guess is it'll be a little everywhere. It'll be available prescription and then over the counter through functional medicine doctors. I'd love your thoughts as an.
That's a really great question. I've spent a lot of time thinking about that. I think there's definitely going to be a pharma route. So the doctors will prescribe it and you go to the traditional pharmacy and get it there, like Epidiolex or Sativex. I think that we're going to continue to have dispensaries where you can walk in and see a wide variety. I think that there's definitely going to be, say, nutraceuticals that you find in the drugstore or the counter, maybe even at like Costco, Walgreens, for CBD supplements, and maybe at some point even cannabis, including THC supplements. What I'm really interested in is there's a lot of people doing specific formulations for specific indications. So for example, Zalira, they're an amazing company, and they're doing stuff they have their hope for autism. Right. And I believe they're doing breast cancer as well, and some other indications. And you're having specially crafted, high credibility products out there for specific indications. But I think, if you go into a dispensary, there's literally hundreds or thousands of products there. Right. And the beauty of cannabis, I think, is if you look at the different modes or methods of ingestion, the way that you can take it. You can take a pill, you can take a gummy, you can take a beverage, you can take a tincture, flower, a patch. There's so many forms of use that you don't see that in any other medication. And that, I think, is really amazing because it accommodates so many more people in so many more conditions. At the same time, the variety can be overwhelming, but when you're talking about medical care, there are two things that are really, really important. One is consistency, so that when you take the same product time after time, you're getting exactly the same thing. And if you're taking a plant, a sample of cannabis, even, two samples from the same plant can have slightly different profiles. And so the traditional medical industry has a big problem with the lack of consistency, where if you're looking at the whole plant, whole plant extracts, those profiles are going to change at least a bit from plant to plant and even sample to sample. And then you also have, of course, the dose size. If you're using, say, a vaping device, smoking a joint, how much are you getting in a puff? And
Right.
a lot of people talk about this. And so there's a lot of work going on in people trying to fit between whole plant and traditional, who are working on standardized doses and consistency of doses from batch to batch to batch. Now, the tension here is that by establishing consistency, and certainly that is a good thing, that comes at the expense of variety. So someone who's trying to do, say, a line, they can do a line of, say, 5 products, and they're producing each of those 5 exactly consistently in exactly the same dose from batch to batch to batch. But they can do 5. They can't do 100 or 200 or 500. And when you consider that cannabis is personalized medicine and each person has a different system and needs something different,
Right.
then that's a problem, because you want a lot of variety to satisfy all the different people. So the thing I think that makes cannabis so fascinating, but so difficult for people to figure out, and kind of they want to pigeonhole it, it's not traditional healthcare. It doesn't fit the traditional healthcare mold. So people are trying to understand it and kind of square that peg, square that circle, whatever the saying is. They're trying to fit cannabis into the traditional industry mold, and it just really doesn't. And for me, the really interesting thing will be to see how that all plays out.
Yeah.
Well,
It's funny.
I am amazed that we can now dictate the type of DNA in each plant, that we can pick up different terpenes to steer the cannabinoids in the plant so that it comes out one strain or another. I mean, there's so many ways now to influence a weed. And, it used to be, I used to think, oh, it's just a weed. It'll just grow naturally. And it's not like that at all. They can dictate the genetics of these seeds and the plant. And hopefully we'll get enough research to actually start growing specific strains to handle specific ailments. But one thing I do want to ask you about is the Western medicine versus Eastern medicine philosophies and the role that cannabis can play in it. Whereas in Western medicine, with big pharma and the consistency of dosing and handling and going after symptoms, as opposed to Eastern medicine with a holistic view of wellness and trying to actually cure why this symptom occurred, the role that cannabis might have in the middle of this.
Well, it's interesting because so over the decades, we've figured out how to, to address the acute problems that cause death. So we have like sanitation and vaccines. So people generally, this year has been a bit different, but people generally don't die of viruses or infectious diseases because we've cured that. So people are living longer, and they're also getting more complex problems. And medicine started out back with the germ theory of disease, and when pharmaceuticals started first becoming standardized in the mid 1800s to they were trying to legitimize medical care. At that point, you had all the tonics and the doctors selling these solutions. That's kind of like the CBD market now, where you don't know what you're getting. And the FDA was trying to, or the FDA wasn't created then. The government was trying to legitimize the practice of medicine. And that's when you started with the isolated molecules and making sure everything was purified and isolated and high quality stuff and consistent from batch to batch and safe and efficacious. And so that has served us for decades. And however, and kind of going back to AIDS, where cannabis started kind of gaining some momentum in society with AIDS, I think that was one of the first diseases out there where they really started using drug cocktails. And they're using multiple different drugs to address problems because they understood that it was a complex problem that had more than one mechanism of action and more than one problem going on in the body. And so now if you look at what's going on, doctors are increasingly using drug cocktails for cancer, for AIDS, and for other diseases. And if you think about cannabis, one sample of whole plant cannabis is really a drug cocktail. It's just that it's a cocktail designed by Mother Nature, not by traditional healthcare providers. And so they're kind of, the Eastern and medicine and Western medicine are kind of converging in the sense that over the past probably 2 to 3 decades, we've been moving more towards drug cocktails, which is exactly what cannabis is. And the problem with cannabis is they're going to have to figure out how to accept a product that has a lot of moving parts that they haven't fully figured out yet. We can wait, say 20 years, 30 years until they have fully figured it out. But what about all the people in the meantime who are suffering and who need something now?
Right.
And
right.
So I think, hopefully, I hope that the traditional industry will recognize this drug cocktail issue, recognize that there's always more that we can learn about something. But even despite the fact that we don't fully know what's going on with cannabis and all the different compounds in the plant that are working together, that they are having benefits and they can be effective now.
Gotcha. Well, Ruth Fisher, PhD, and the author of the Medical Cannabis Primer, which you can get on Amazon. I certainly appreciate you joining us today. I always feel so humbled when I talk to researchers like yourself, because a lot of this stuff goes over my head, but I get the big picture, and I am going to be leaving my body to science, so have at it whenever I kick the bucket, as it were. That's how I feel.
For a long time.
All right,
and I think patients especially can be grateful that, to your point, it might be a while off, but right now I think we have some tools available that can help people. And I certainly think that you have some amazing research. So thank you for contributing and sharing that. And people can buy your book on the Medical Cannabis Primer on Amazon.
Yes.
Okay, great.
Terrific.
Or at the website, medicalcannabisprimer.com. Okay.
That's right. And so Ruth, again, thank you very much. And we're going to take a quick break and then come back with one more doctor, Dr. Z, Dr. Ryan Zachlin, our in-house doctor, if you will. He'll be joining us for the final 30 minutes. Don't go away. Cannabis Chat continues after this.
We are Pro Cannabis Media.